If you suffer from back pain, then you know how difficult it can be trying to find relief. And joining me now is Dr. Ali Araghi with the Core Institute to tell us a little bit more about some common neck conditions. It's nice to see you here this morning. How are you doing?
Good. Good morning.
You're an orthopedic spine surgeon, right?
That's correct.
So tell me a little bit about what some of the common neck and pain conditions are that you see most often.
Well, basically, the common neck conditions that we see are patients that come in with neck pain and with arm pain, and they'll wake up one morning and have some numbness and tingling in their hand, potentially some pain radiating down the arm, and even weakness sometimes is associated with it.
The arm pain kind of makes me go, huh, what would the arm have to do with the neck?
Exactly. So, and that's a very good question. In the neck, we have vertebrae, and then we have the disc in between, which is a cushion in between these vertebrae. And what will happen is sometimes a piece of this disc will rupture, and it'll go backwards, as you can see in the animation, and the purple portion will actually go backwards and start pressing on the yellow nerves that you can see, and you can see the nerves being displaced. And what happens is the pressure on that nerve will cause it to malfunction and presents itself as numbness, tingling, pain, weakness. And you can see the nerves getting inflamed. So the point is that we need to somehow get that nerve to calm down. And a lot of times we can treat this with injections and physical therapy and anti-inflammatory medications. And other times, unfortunately, it fails, and the piece of disc will just be refractory to the conservative treatment. And then we have to go after that purple fragment that you see that's pressing on the nerve.
And that purple fragment is the disc?
Exactly. So the outer covering is called the annulus, which is the outer covering of the disc, and then the center piece, which is the purple fragment, is called the nucleus, which is the herniated disc.
So what treatment options are there for people that have problems with discs, as we've just seen right here?
Right. So, as I said earlier, the most important thing is to try to conservative care and not consider surgery. But if they fail and they have no other options, then what stood the test of time is the old-fashioned way to do it, which works very well, is a cervical fusion. In a cervical fusion, what we do is we take the two vertebrae that are here and the disc in between. The nerves are back here, and there's a piece of disc back here, as you saw in the animation. And what we do with this is we take out the disc, and we put this piece of bone or a cage in between, and then we fix it with screws going up and down into the vertebrae above and below. This works very well, but it actually stops the motion between these vertebrae. So the newer technology that has been introduced and is FDA approved is an artificial disc replacement, which we do the same thing through a small incision in the front of the neck, and we put these two metallic implants in with a plastic piece in between, and what that actually allows us to do is it allows you to move your neck. So as a result of this operation, you don't lose any motion or very little motion, whereas as a result of the former operation, you do lose some motion.
Which is sometimes a loss of quality of life.
To some degree, absolutely.
Right.
But the newest technology, which is actually so new that I'm the only surgeon in Arizona doing it, is a technique where we basically, instead of touching the patient's disc, we drill a hole above the disc through the bone, which will regenerate, and we drill a hole backwards into the spinal canal, and from the back side, we will fish out this fragment of disc through the hole in the bone and never touch the disc. So this has the advantage of not only maintaining your motion, but also maintaining your own host disc and not having to have any metallic or foreign objects in there. So this is not for every disc herniation, but it works very well for patients with the appropriate disc herniation.
So what does that do in terms of recovery and rehab if you're able to go that route?
Right. So when we do a fusion like this, we immobilize the patient, and depending on the bone quality, some people will immobilize longer, some people shorter. When we do an artificial disc replacement, we immobilize them less, but we do have to immobilize them for a certain period of time so that those metallic end plates will grow into the bone so that they don't move or come out. With this technique, where we drill the hole in the bone, we basically do not have to immobilize them at all, because all we did is we took out the offending portion of the disc and we left the rest of the disc in place.
Just in place, yeah.
Exactly. So that is really the most natural way to do it if you're a candidate for that.
Dr. Ali, I have to hand it to you. You have described what I fully expected to be extremely difficult to understand in a way that I truly understand now.
Well, thank you.
And that doesn't always happen for me. So I appreciate you teaching me a little bit about something about this. I'm glad I don't suffer from it, but I know that people that do are going to be glad to hear about this.
Thank
It's
you.
nice to have you on the show. The Core Institute has locations all over the valleys, Central and North Phoenix, Gilbert, Goodyear, Peoria, and Sun City West. You can call 1-866-974-2673 or visit their website, thecoreinstitute.com, to schedule an appointment with one of their fellowship-trained physicians.